Welcome, I'm Dr. Melina Roberts and I want to talk about the thyroid. So the thyroid is this gland, it's our endocrine gland that just sits right in the neck here, and what it does is it sets up the temperature of every cell in our body. So every cell in our body needs to operate at a certain temperature, and the thyroid is responsible for that. Now, if that thyroid is just slightly under functioning, so the temperature of the body is just slightly low, what happens is that it decreases the metabolism of every cell in the body. Now, how we see this symptomatically is we will see this as dry skin and brittle nails. We'll see that as cold hands and cold feet. We sometimes see this as constipation. So someone who just doesn't move their bowels on a regular basis can tell us that the metabolism is just slowing down. One of the most common things we see is weight gain or difficulty losing weight. So it's those patients who are working out and eating really well, and they still just can't lose weight. We see that so frequently. So other indications that the thyroid may be under functioning can be hair loss. So often patients will come and see me and they'll say that they're losing clumps of hair, or they notice that their hair is thinning. Or it can be that the outer 1/3 of their eyebrow is lost, that they're missing that. And we can see these as signs that the thyroid's not functioning at its best. We can also see it as PMS or fertility issues. We can see that as we have some dysfunction in the thyroid, we also see it happening in terms of those female hormones. And another common thing that we'll see in terms of low thyroid function would be depression. So unfortunately, we see those hand in hand quite frequently, is that depression and thyroid disorders. And that's why I always say that when a patient presents with any sort of depression, that we want to uncover whether it's actually a under-functioning thyroid that may be contributing to the depression. Because often when you address the thyroid, the depression will resolve itself. So there's a lot of people who are put onto antidepressants when really we should be working on their thyroid function. Now, another thing that can show up as well with an underfunctioning thyroid is fatigue. And, how often do we see fatigue in our practice and in our society? It's quite frequent, but this is definitely something that can be associated with an underfunctioning thyroid. And another symptom we may see is poor concentration, poor memory, brain fog. We see this quite frequently when we have that under-functioning thyroid. So these are just some things, some symptoms that may show up that might put that light bulb on and make me think that we may need to investigate the thyroid function a little bit further to see if what we're dealing with is an under-functioning thyroid. All right, so thanks so much for listening. I encourage you to share this with your friends and family, to press the like button, to make a comment below, and until next time, continue to learn, grow, and build health.